Effective health education is research-based and theory-driven. And yet this is not always what drives the bus in health education. I have heard many times teachers explain to me that this particular lesson that I've observed is one of their favorites, or the students just love this lesson. Or moreover, I've heard students or teachers explain that this really isn't my lesson, but the teacher across the hallway, she gave this to me. She says, everyone loves it. Well, maybe we have two different things going on here. It's wonderful that teachers enjoy teaching certain lessons, and it's terrific when, lo and behold, students enjoy it as well. And yet that's not what drives the bus for us, or shouldn't drive the bus for us. If enjoyment and satisfaction were our number one goal, then maybe we would spend the resources that we're putting towards health education and buy everyone an Xbox. Because I think the feedback would be very positive if we did that. So we need more. We need to be much more philosophical about what we do and why we do it. And those decisions need to be anchored either in research or in theory. Not that you need to be a researcher or be an expert in theories of behavior change, but they should absolutely inform what we do and how we do it in the classroom. Welcome to Health Ed with Cougar. Today we're talking about characteristic of effective health education number 2, which states that health education, if it's going to be effective, should be theory-based and research-driven. There are no shortages of health behavior change theories. You're likely familiar with many of them. I'm not an expert in theory, that's for sure. I'm very familiar though with the health belief model, with social learning theory. My favorite theory in health education that's related to behavior change is called the theory of planned behavior. I think it's my favorite because for me, it's simple. There's only 3 main constructs or concepts, I might say, that really can guide what I do in my classroom. Now, I don't expect that the average health educator is doing research on his or her own. And again, I don't expect that we're experts in behavior change theory. If you're shopping for curriculum, a curricular package, a pre-packaged curriculum for your class, I think it's really important to make sure though that it's been evaluated, that independently and objectively someone has looked at this and can tell you that, yeah, this really is research-based. Like what we're doing in this curriculum, the activities, like we've established through some evaluation that it's effective. The way that I'm presenting this today for each of you is to think about theory though, and not related to purchasing preset packages for your classroom, but in developing individual lesson plans that you, the living, breathing health educator, can personalize. So as you sit down to lesson plan, how can you become more theoretical in your planning? And as you develop activities, how can you make sure that they're consistent with what we know in social science helps people change behaviors? Because never forget that the goal of health education truly is to help young people adopt and maintain healthy behaviors. This is where I really love the theory of planned behavior. There's 3 main constructs. The first has to do with behavioral attitudes and beliefs. The second has everything to do with social norms, which I'll talk just a little bit about on this video, but we have an entire video dedicated just to social norms and normative education. And the third construct has everything to do with self-efficacy, or what this theory coins, the term they used is perceived behavioral control. So let's talk just very, very quickly about how you can apply these 3 constructs into your lesson planning. First, look at behavioral beliefs and behavioral attitudes. Behavioral beliefs, this is what the young person thinks that this behavior will lead to. In other words, what are the expected outcomes? Do they think it's going to be favorable for them if they brush their teeth? Do they think it's going to go poorly for them if they drink and drive? These are your behavioral beliefs. Now, how do you shape those in your lesson plan? How do you go about this in the classroom in helping students accurately perceive and anticipate an outcome with a behavior? I really like using facts and figures here. I really like using what we're going to call functional content knowledge. Help them accurately perceive the consequences of both positive and negative behaviors. The second element, though, is the behavioral attitude. Do they care? And is it perceived as something that's going to be beneficial for them? There are many health behaviors that, quite frankly, a 16-year-old might stigmatize. Like, oh, I'm not going to do that. That's not cool. Ooh, I would never eat that. So how are we going to shape their attitudes so that they see a health behavior as something that they want to engage in? Again, I think we're going to use some facts and some figures, but I think now we're going to introduce some storytelling, and we're going to share some anecdotes. And we need to be careful with this. Every time you tell a story, you need to make sure that you're not blowing things out of proportion. We always need to be exactly honest and truthful as we share everything with students. Stories, no exception. But we can shape and mold some attitudes favorable of health behaviors, and I actually have found that students really appreciate those personal anecdotes and those stories. Some of them are positive, like, I did this and I got a favorable outcome. And sometimes, and be careful with this approach, but sometimes I can share, I didn't do this, and man, if I could go back, I would. Like, man, experience and life, it's kind of punched me in the nose, and this is something that I didn't value at 16, I would totally value now if I could go back and do it again. So there's many ways that we can actually look at behavioral attitudes and beliefs and incorporate that element into our lesson plan. It's important. Now, don't stay there all day, because this is just setting the table for behavior change. The second thing is social norms. And there's really kind of two aspects of social norms. The first is really what's normative. Do most people brush teeth? Do most people drink and drive? Now, we'll talk more about this later for sure, but it's really important that we understand that most teenagers, they tend to exaggerate in their mind. So we'll call that their perceptions. They perceive that their peers are engaging in far more risk behavior than they actually are. And then, but this is true in every single health category. They think most of their friends are using drugs or smoking this, smoking that. So it's really important that we correct those misperceptions. And we have all sorts of data, and we'll talk about this more, I promise. But we have the YRBS, we have Monitoring the Future, we have all sorts of terrific, reliable data that will help young people understand that most people aren't engaging in risk behavior. Most don't. And that's that first aspect of social norms, really important. The second aspect is what we call a subjective norm. This is that the individuals in this student's life, their parents, their soccer coach, the neighbor, what do those relevant others expect that young person to do? In other words, what are the expectations? Do they expect them to make really poor health decisions, or do they expect them to be, get their act together and to really make good decisions? So that's important. Now think about how we're going to use these two aspects of social norms in your lesson plan. It's going to be important that young people are exposed to and have access to good, reliable data that shows how many people are engaging in certain behaviors. Now, in particular, when behaviors are trending the right way as far as prevalence, I think we should lead with this in our lesson plan. For example, when in 2019, far fewer students are binge drinking than they were in 1996, I would lead with that if I were teaching a lesson on alcohol. Hey, everything's trending the right way. That's absolutely the first tool out of my tool belt, is this social norms approach. If far fewer students are getting pregnant, so we've cut teen pregnancy or unwanted, unexpected pregnancy in half, we got to lead with that. That's the best thing ever. So that's how we're going to incorporate that into our lesson plan. Really important, though, that they also have an opportunity to discuss each specific health behavior with trusted others, with those that they look up to. And again, we'll talk a lot about parents and interacting with parents, but anyone who they look up to and who has some social capital, so to speak, with your students, we need them to say it. We need them to share what their expectations are for your students. That's going to be really important. So we're going to look at our lesson plan and say, okay, I know this is how people change behaviors. How am I going to incorporate some behavioral beliefs and attitudes? Where am I going to incorporate? Is it an activity? Is it a guest speaker? But where am I going to hit on social norms, both normative education and subjective norms? This is crucial. And then last but not least, we have to talk about self-efficacy, which is essentially perceived behavioral control, believing that I can do the things that I need to do. Do I have the tools in my tool belt to get that done? So I always come back to skill building. I always come back to, it's not enough just to shape their attitudes and their beliefs. It's not enough just to say, look, most people want you to do this, or most people don't engage in this, this unhealthy behavior. I have to actually develop skills, allow them to practice those skills, so that they feel like, oh my goodness, as I leave the classroom and go into that brave new world, I can actually do the things that I'm supposed to do to ensure good health and wellness. So again, this is skill building. This is connecting students with resources, both in the community and at the school. It's linking them to trusted others, to parents, to counselors, to clergy, to coaches, whomever that might be, who they can lean upon, who can be assets for them in their lives. And again, it's specific skills, whether those are decision-making, communication, goal-setting skills, specific skills that they're able to practice in class that will prepare them for a real-world setting. So that's a lot. I'm definitely rambling in this particular video. I apologize. But if we can think more theoretically about what we're doing, we're not just creating a lesson plan that looks like a menu, just an a la carte of all sorts of fun things to do for the next 60 minutes for our students. It's really dangerous when we just try to entertain them to death and hope that they'll give us a positive rating on our class for the day. That's not what we're about. So we need to think more theoretically and anchor everything we do to something that's either research-based, like we've said, or theory-driven. The students don't actually need to know that, oh, today we learned A, B, C, and D, and it was according to the health belief model. They don't need to know that, but you need to know that. You need to know that what you're doing is backed up by research or by theory. In other words, by what we know in social science helps people adopt and maintain healthy behaviors. I know you can do this. Don't overcomplicate it. Just look at your lesson plan and say, where am I addressing theory in this lesson, and how's it really going to help move students forward? That's it. You've got this. Thanks so much. I'll see you next time.